It's something many people struggle with, how to make healthy habits a lifestyle instead of a temporary fix to lose weight. In this episode, Sarah Bush nurse practitioner Andrew McDevitt walks viewers through ways to achieve sustainable, lifelong health.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for season 15 of WEIU TV's Being Well. I'm your host, Lacey Spence, and today we are kicking things off talking about our healthy lifestyle habits. So our guest today, we've got a new guest to the show. We've got nurse practitioner Andrew McDevitt. Welcome to the show.
Thank you, Lacey. I'm honored to be here. I appreciate it.
The pleasure is ours. So I know that I have a little background with you because I got really excited when our media liaison said that you were going to be on the show because you're newly my provider. But for our viewers at home who aren't familiar with you, can you give us a little bit of a background about who you are, where you're at, what you do?
Yeah, so I'm Andrew McDevitt. I'm a nurse practitioner. I'm from this area. I'm from the Mattoon area, so I'm from the county. I've worked at Sarah Bush Lincoln for almost 11 years now. But here in the last few years, I've now started in the role of not only primary care provider, but also running our weight management program and managing our medical weight management program, and now even into our bariatric and bariatric surgery program at Sarah Bush Lincoln.
Perfect. So we're going to try and hit a lot of that today. So as we're talking about healthy lifestyle habits, kicking things off, what should someone's goal weight be?
That is kind of a difficult question to answer because there's no specific number that I can throw out to you and say, oh, it should be X amount. Of course, it's going to vary from person to person, but what you need to do is you need to start looking at a criteria of things and then make a decision based off that. So, for example, if I have a patient that comes in and I get asked that question all the time by patients that come in to see me for weight management. If I have a patient that comes in and asks me that, I tell them, well, the first thing I look at is I look at the BMI. BMI is, of course, our body mass index, and that is a ratio that is played out on our height versus our weight, okay? It's not perfect. I know it's not a perfect scale, but it's okay for the general population. So that's the first thing that I look at. Now, once I look at that, there are different classes within the BMI, okay? So I then assess the patient clinically. So, for example, anything that is a 30 BMI or greater is considered in the obese category, okay? What I do though is I'm going to look at that clinically, and I'm going to look at the patient and see how that weight is distributed. For example, you could have a bodybuilder, or you could have a collegiate football player or something of that nature that is a very, very or higher in BMI, but has a higher muscle mass. It's not necessarily that they're clinically overweight or obese. It's just that they have a higher weight to their height ratio. So whenever I look at that and I think about how to clinically correlate it, I start to look at the first thing is abdominal measurement. So we look at that and we look at what is considered the metabolic syndrome requirements, or the criteria rather for metabolic syndrome. So for example, for a male, it would be having a waist circumference of 40 inches or greater is considered a criteria for metabolic syndrome. So I would look at that. I would consider the waist or the abdominal circumference. For a female, it's 35 inches or greater. So then I would look at that and see, so I could correlate it clinically by assessing the patient. There's also different things to look at. For example, there's sarcopenic obesity, which is like a lack of muscle mass. So even though they may not hit the scale on the BMI chart, we look at they have a lower muscle mass and maybe a greater waist circumference, they might still fall closer to that category and therefore have the risks to that. So I say all that to answer the question of, it's not necessarily that I could sit here and give a number, but I would start to look at the body mass index, see where that falls on the scale, and then look at how your weight is distributed, and then make a determination from there on what is considered, overweight versus obese versus a healthy weight.
So you're trying to make sure us folks out there have maybe heard the term big boned.
Yes, yes.
So you're looking at that, you're taking it into consideration that I might be carrying more muscle or whatever.
Yeah, and a good example of that is with females, for example. Obviously we see how males and females will carry weight differently. Mm-hmm. So I have a lot of female patients that'll come to me and tell me about how, their hips or their legs are larger in size. Well, when we look at metabolic data and we look at studies when it comes to heart disease, diabetes, pre-diabetes, things of that nature, really that ratio doesn't necessarily matter as much as the abdominal ratio does. So I may have females that'll come to me and they'll say, well, I carry more weight in my my legs than I do my abdominal area. Well, that may not be necessarily a bad thing. Mm-hmm. If we look at it and we see that the abdominal circumference or the waist circumference is appropriate, then that's okay. We're not necessarily as concerned about that. Males, they hold fat more so in the abdominal area. Mm-hmm. So again, I'm clinically correlating and I look at it and I say, okay, well, if you have an abdominal circumference that's greater than 40, I know that you're at higher risk for various metabolic diseases, down the line, et cetera. So again, you kind of take everything and you're clinically correlating it to have a better interpretation.
So once you've gone through this process, very individualized, to figure out what your goal weight maybe should be, mm-hmm. How do you proceed? What is like a good time frame or anything? Because I know a lot of people, myself included, are apt to bite off more than you can chew and say, like, I've got to lose 10 pounds by Friday, and that's not going to happen.
Right. So what I tell my patients whenever I'm seeing them is I say, listen, I don't want you to lose any more than about 2 pounds per week. That's kind of a maximum number. The reason is just from studies and years, we know that in order to lose the maximum amount of fat, 2 pounds a week is about the maximum. If we're losing more than that, we're starting to get into muscle mass, possibly even skeletal mass, those kind of things that we really don't want to lose. Mm-hmm. And so I don't really want people losing 40 pounds in a month, because not only do I know that that's not healthy, but I know it's not sustainable. Now, there are instances, there's caveats for everything. Yeah. There are instances in which I would say, the benefit of losing a significant amount of weight in a short time outweigh the risks of it. But when I'm talking, on a general scale here, I'm looking, about 1 to 2 pounds per week is appropriate. And what I tell patients also is, listen, I'm playing the long game. I'm not interested in you losing weight in a month and then putting a lot of it back on the next month. I'm interested in that long-term sustained progress where we're working, month over month over month to not only continue to lose the weight consistently, but keep it off long-term. I'm not interested in the yo-yo stuff. So we want to make sure that we're keeping it off to help the patient be successful 2 years, 4 years, 5 years, 10 years down the road.
So then, is diet a bad word? Is it healthy to diet?
Yeah.
How do you depending on how you use it?
The way that I look at it is, diet's not necessarily a bad word, but I look at it more of a lifestyle. Mm-hmm. You're looking at trying to make overall lifestyle changes. And I can tell you, I am not somebody that says you must eat this and this and this and laying everything out, or have these, pre-packaged meal programs or anything like that. And I'm not saying there's necessarily anything wrong with that, but what I look at is the sustainability of it.
Right.
And, I tell my patients, I'll say, listen, we're going to have cookouts, we're going to have birthday parties, we're going to have times we're going out to eat, celebrations, whatever. Is that program going to be sustainable for you? And so, it's more so about, how you're going to live your lifestyle, doing things in moderation in order to, set yourself up for success. What I do is I look at how we can build that over time. People did not get in a position when they're seeing me overnight. And so I'm not trying to make changes overnight. This is laying a foundation and building and working on it over a course of time, which is again why I say I'm playing the long game here. I'm trying to have them successful for the future, not just a quick fix.
Do you think we overcomplicate things, maybe because of diet culture or whatever, but just kind of this mentality of I've messed up because I did have the cupcake at the birthday party, like, it's over, might as well just throw in the towel?
Definitely. People a lot of times lose the battle here before they'll lose it anywhere else. One of the things that I'll tell people is I'll say, listen, just because you made and I say mistake because not everything is a mistake, but just, maybe you slipped up on something you didn't think you were supposed to do, doesn't ruin everything, so don't have a cheat meal or a situation in which you did something that maybe you didn't think you were supposed to do last 2, 3, 4 days, a week or longer. I'll have times where I'll see patients and I'll be months in between seeing them, and they'll come in and they'll say, well, I messed up on vacation and I just couldn't get back on track, and then they were too nervous whether to come back and see me or whatever. And I said, listen, there's nothing we can do about what has happened in the past. Let's try and learn from it and move forward. Yeah, you ask about overcomplicating things. I definitely think so. I definitely think that people, trying to, make radical changes all at once makes it really, really difficult. So just that piece by piece is kind of the way that I'm playing it. And don't overcomplicate it. Don't overthink it. Just make small changes, each day at a time, or each week at a time, or each month at a time. Over time, it's going to build to long-term success.
And I think people struggle with trying to find that balance, because you always kind of hear the mantra of like consistency is key. So then the second you're off of it, trying to find that, what is your healthy lifestyle? When can I allow myself to play or to have, just right back onto the vegetables or what have you.
Right.
So as far as exercising, we've talked about diet a little bit, and I think again, it's another one of those people dive head first, and then it's like, I hate running, or I hate, the yoga or
whatever. Yeah. I'm not an exercise person. I hear that a lot. I'll tell you what my initial goal that I give patients whenever they very first come and see me, I'll usually give kind of a couple of goals to work on, just kind of based on where they're at. The first goal that I tell people is I say, listen, at least 3 times a week. Duration, of course, it's going to be kind of health dependent and what they're able to do. But if you're young, you're healthy, you're able-bodied, I'll say 25, 30, 35, 40 minutes in duration. 3 times a week, some kind of designated exercise to start. And I tell them, at this point, I don't care what it is. You can go on a walk 3 times a week. You can do yoga. You can go to the gym. You can, do group fitness. You can do YouTube fitness videos. You can have a dance party with your kids for 35 minutes. I don't care what you do, but something to start getting the heart rate up and start your body working. Now, over time, I expect that to develop, but what I want people to start doing is building a habit of getting that into your schedule. And we hear all the time that I'm too busy to exercise or whatever. We make time for what we want to. And so, I know there are special situations and things like that, but typically people can find 30 minutes 3 times a week to try and do something. Now, over time, I anticipate that to grow. And when you talk about specific exercises that are going to help not only to lose weight, but also keep it off and also help our long-term health in general, one of the things that I'm very, very big on talking is working on strength and resistance of some kind. Okay. I'm not saying that you have to go to the gym and throw 400 pounds on the squat bar and start doing it. I'm not saying that, but something that's going to be putting the muscles under some duress to make them work a little bit. We know that when you correlate muscle mass, that usually equates to better health. And I mentioned earlier sarcopenic obesity, so that's a lack of muscle mass and an increased amount of adipose tissue or adiposity. Adipose tissue is fat mass, essentially. But when I look at that, you look at the numbers of that, the health risks are extremely high for that. Those are people that are low in muscle mass. Well, whenever I'm looking at how not only to lose weight, keep it off, but our long-term health, I look at muscle mass, and that's very important. So having that strength training and having that basis of muscle mass is going to be very important to our long-term health. Plus, aesthetically, it's not bad either.
Yeah.
And, I know we're talking about health and whatnot, but guess what? Aesthetics are part of this deal too.
Yeah.
And I get it. Like, listen, I spent 10 minutes on my hair this morning to get here, just to make sure it was just
Nailed
in the right
it,
place. So,
by the way.
well, thank you. So I get it. But the point is that, all of those aspects combined are going to help people in their long-term health, not only physically, but also emotionally, mentally, in their confidence and pretty much every aspect.
Mm-hmm. And I feel like pretty often we hear kind of the rhetoric of, I have tried everything. Everything I'm doing is not working. So at what point is it a talk with you? Is it you explore surgery options or medicinal options? What is next?
Sure. So, I talked earlier a little bit about just kind of the various classes that people are at and, the way that things, whether it's they're falling on the BMI scale or abdominal circumference or increased risk or comorbidities. Let's say they have, high blood pressure or severe arthritis or back pain, severe back issues, things of that nature. What I'm looking at is I'm looking at not only the current health status and the severity of it, but I'm also looking at what the risk status is. Because you can technically have have excess weight or obesity and still be metabolically healthy, but we know that risks long-term are significant. Well, you talk about different interventions, whether that be surgery, whether that be medications, or just intense lifestyle management. You said, I've had people that have came to me and tell me they've tried everything. Well, there's so many different aspects to this that, I get it. There's a physiological aspect to weight and weight loss. So, I get where people are coming from in that regard. But if I'm correlating clinically and treating this like a disease, like I do weight and obesity, I'm looking and I'm seeing the severity of where they're at. So, if we have significant back pain that's significantly limiting mobility, and a patient's diabetic and they're, have extreme cardiovascular risk factors, I might be looking at a more significant intervention like surgery. If I have somebody that's at high risk for all those things, have tried different things and really struggled with their weight, and I know that, hey, they may be in some trouble here long term if they're not getting it off, I might be talking about medications to implement. But there's also cases where, I might see some patients that will come to me and say, yeah, I've tried a couple of things, but, I'm not really known where to go. Well, I might just stick with intense behavioral modifications and increased exercise and those kind of things. So it's just kind of based on, where their clinical status is, based on what significance of intervention that I would talk to the patient about implementing.
Now, can medications we take cause us to gain weight?
Yeah, there's a lot of medications that are out there that cause, obviously weight gain, but a lot of them that stimulate the appetite as well. And, when we look at appetite, a lot of people think about, this is kind of a stigma, but willpower to it. And, there's certain aspects of that, but there's also a physiological drive to that. And so, appetite is kind of up here as well as up here, and there's hormones that are involved. Well, some of these medications stimulate that to where some people never are feeling that fullness or never feeling satisfied. So they're going back for more. So these medications can really, really induce that. And, some of the things that I do is I look at that and I try and implement other interventions, whether it be medications or whatever, to try and help solve that. But to answer your question, yeah, there's a lot of things. There's a lot of medications that can come into play. There's a lot of disease processes that can come into play. Even things like lack of sleep, poor sleep can affect your appetite, can affect your energy levels, your metabolism. It can affect all of that. All of those things can play a role, and that's why I treat it like I do, more so as a disease than how it's stigmatized as a willpower issue, if you will.
And I think moving forward, just trying to make sure that you're attacking these, it sounds like it's holistic, but there's pillars to it. And I think that's a theme that we're going to end up seeing throughout some of our other episodes throughout this season. So as we were looking at just the other options to treat weight loss, at what point do you consider doing something like a bariatric surgery or something like that?
Yeah, again, I have to kind of correlate clinically whenever I see a patient, but I'll give you an example. I saw a patient not too long ago that is somebody who would be, in their 50s roughly. They are type 2 diabetic, have dealt with weight issues most of their life, have significant peripheral neuropathy, so they're having trouble, nerve pain throughout their lower extremities, have arthritis in both knees, significant back pain. I'm looking at that patient, and it's easy for me to sit here and say, well, you need to go exercise a whole lot more. You need to, put all these interventions into place. And there's a place for all of those things, and there's certain modifications that they could do to, to be active and exercise. But having said that, how realistic is it that they're going to be in the gym 4 days a week and exercising, with their significant peripheral neuropathy and their, significant back pain, and somebody that struggled with weight for many, many years, their cardiopulmonary fitness is probably not ideal. I look at that person and I say, okay, listen, this person is at significant risk when I look at all of their comorbidities there for a potential cardiovascular event, whether that be a heart attack, a stroke, or even, outside of that realm, something just as significant. The benefit of having surgery and having that weight loss in that patient is going to outweigh the risk of it. The benefit of limiting the risks of those potential diseases, and this person's already diabetic. They're already dealing with a chronic illness. So, we're going to help limit that, in addition to helping with weight loss that can help limit their arthritis, help limit their cardiovascular risk. I'm looking at each patient individually, but I'm looking at the severity of intervention versus the severity of their disease state with obesity. So that's kind of how I break that down. Now, I have a lot of patients that just come in and just, ask me, what route do you think I should go? And, I kind of look and I say, okay, listen, this is where our risks are. You told me you've tried all of these different things and not had success. Maybe it is time that we look at a greater intervention, with bariatric surgery or surgical intervention or even medications.
Mm-hmm. And again, we keep saying stigma or the culture or whatever it's been told. Mm-hmm. Going through bariatric surgery, the gastric sleeve or any of that, that is nothing to snub at. Yeah. You still have to prepare for that and lose weight for that and go through the healing process, change your eating habits.
Absolutely.
One way or the other, it's still changing who you are, what you've done.
Definitely. And that's a big part of what my role is within our bariatric program is I'm helping prepare the patients preoperatively to set them up for success postoperatively. Mm-hmm. And I used this reference earlier just in the term of long-term success. I don't want somebody to have the significant intervention and the risks that come with surgery if I don't believe that they're going to be successful 3 years, 5 years, 10 years down the road. Mm-hmm. So my job is to help prepare people for that. Now, when it comes down to it, obviously people make their own choices, and there's not a lot that you can do. Right. But I'm trying to help them, set them up for success in the future by giving them all of these options, lifestyle-wise. We work with a dietitian. We have our medical exercise program at Sarah Bush Lincoln where we can try and involve patients. I'm working with them on the medical side of things to try and set them up to where they have all those tools to make the lifestyle interventions, both pre-operatively and post-operatively. One of the things I tell people, and this is in regards to weight loss or medications or anything, all of these things are just tools. Now, some of them are bigger tools and more significant tools than others, but they're all just tools to make it easier on us to perform the lifestyle modifications to help us to lose the weight and help our long-term health.
And as you get to that goal weight, how important is it to also plan for maintenance, which people call it maintenance, but it really is just keeping up that lifestyle, because I know a lot of people are guilty of, you will lose the weight. I've done it. You lose the weight, you gain that back and then some, and then you're just kind of yo-yoing, but you don't plan for maintenance or anything long term.
Yeah. Maintenance is a whole nother ball game. Like you said, it's something that you have to look at as a long-term lifestyle, not necessarily a diet or something that you're just doing right at that moment. Mm-hmm. It's a long-term lifestyle change. And, there's a lot of interesting research out there in regards to not only weight loss, but weight maintenance. But one of the things that's kind of been out there recently is that the body kind of will find a set point, if you will, of where the weight is, where the body will try and stay at. The body's meant to survive, and so it's going to try and adapt, whether that's increasing the appetite or lowering the metabolism to try and keep weight on, because it's meant to survive. It's not meant to be necessarily losing. So sometimes we see our body kind of fighting against us a little bit. That's why you'll see people hit plateaus and then a lot of times start to gain weight back because they've the body's kind of working against them in regards to weight loss. That's one of the things that I work with several different interventions, is to help people not only lose the weight but also help them maintain that weight loss for a longer term period, because the studies show that if we're able to keep that weight off for a longer term period, we have a much better chance at keeping it off 5 years, 10 years, 15 years down the road, as opposed to somebody losing it for a month and then doing the yo-yo and getting a lot of that back.
Well, we're in our last minute or so here. Is there anything you'd like to share that might help a patient at home, or a viewer at home rather?
So, one of the big things that I'll tell people, and I kind of referenced it earlier, is there's not a lot that you can do about the past. So there's no sense in necessarily dwelling on it. I like to think of the saying, you either win or you learn. So it's either you're winning or you're doing something well, or you're learning from it. There's no sense in dwelling on what's been happening. So if you're struggling with this, if weight's an issue, or it's something you've thought about for a long time, don't dwell on where you've been. Start to make changes now. However that is, whether that's becoming more active, making dietary changes, talking to your provider about it, whatever that is, start to learn from where you've been in the past, and then start to win.
And probably pick one of those and not just dive into all of them.
Yeah. Make small steps. Don't try and do everything at once, because that's a little difficult.
Because we want to win and learn.
Yeah, exactly. So start taking steps though. Don't just think, oh, I'll get to it eventually. Start taking a step, even if it's a small one.
Very well put. Well, we've got nurse practitioner Andrew McDevitt. Thank you for being on our show today. We appreciate it.
Thank you for having me.
Of course. And we hope to see our viewers next time on our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.